A bronchoscope is a thin, flexible tube with a camera attached at the end. Bronchoscopy is a procedure that is used to check the lungs and aid in your diagnosis. During your consultation, please be sure to clarify with your doctor on the need for bronchoscopy, the risks involved, and the alternatives available to you. In this video, we'll show you what to expect when a bronchoscopy is performed. On the day of your bronchoscopy procedure, you will be given a time to report to the scope center for registration. Please arrive on time to avoid delays. You will be asked to fast before the procedure, and some regular medications such as blood thinners may need to be stopped. Please clarify if unsure. After registration, our nurse will ensure important details are checked and guide you through the process. Family and friends who have accompanied you may wait in the lounge outside the treatment area. You will be given a locker to keep your valuables and asked to change into a gown. You will then rest on a trolley bed while awaiting the procedure room to be prepared. An intravenous cannula will also be inserted into your arm, usually on your hand. Sometimes this insertion may be performed in the procedure room itself. When it is your turn, you will be transferred to the procedure room. Once in the procedure room, you will be transferred to the procedure table. Monitoring equipment will be placed on you for constant monitoring of vital signs such as blood pressure. This ensures that the procedure is as safe as possible. Local anesthetic spray or gel may be used to numb the entry site of the scope. The bronchoscopy can be performed either via the nose or the mouth. Should the mouth be used, a mouthpiece will be placed and strapped securely in place. Sedation will be administered through the intravenous cannula on your arm to keep you comfortable, and the procedure will begin. During bronchoscopy, your doctor will examine your windpipe and airways. If necessary, samples will be taken to help make a diagnosis. Bronchoscopy procedures typically last for 30 to 45 minutes. Once the bronchoscopy is completed, you will be transferred to the recovery area for monitoring. Should you feel unwell, please inform the nurses. Patients are usually monitored for 3 hours after sedation. If you remain well during this period, you will be fit for discharge. Having a sore throat, blocked nose, or a mild fever are common side effects that may persist for 1 to 2 days in some patients. In addition, you may cough out a small amount of blood if a biopsy has been taken. You do not have to be alarmed by any of these events. Most patients have no lasting effects. Some patients may be a little unsteady after the procedure, so be careful not to fall. We require a caregiver to accompany you home for your own safety. A follow-up appointment will be arranged if there are any results to review.